So let's see. No, sir, just the starting one. No, sir, just the regular monologue, and then introducing the guest.
you're calling me. Oh, it's calling from here. So I'm gonna put it on speaker. Maya, can you hear me? Wait. Can you hear me? How are you? Let's see if we can, before you start, let's hear Faheem, Dr. Faheem.
I need to transition, and you can hear me.
Oh, you can't hear whenever he's like that? Oh.
So did everyone hear him?
Yeah. Once he transitions,
Oh,
it's like
where
on
is
the
he
live.
now?
He just turned into another tab, probably text you a message. So,
It's all right. It will show. We get it better. Oh, Faheem, your audio is going. We can see you, but your screen is going off.
Oh, okay. I'll do that.
Okay, it's going off repeatedly. So just probably not accepting calls or something. Is it from the phone, right? It's from the phone, right?
Yeah, from the phone, yes.
Okay. So
Just
just come back on, we'll start. We got a few people already, so we can just go on to have it started. Alrighty?
Okay, alright, thank you.
Okay. Okay, you can play the intro video now. Move. Hi and everyone. Welcome to Khan Clinics. We're starting our weekly podcast today. So today we're excited because we have a very interesting topic, and it's really a topic that's not been addressed a lot, let alone it being for adults. In children is sort of non-existent, and that is the mental health aspect in children. We're lucky today because we have our guest is not only a psychiatrist, but he is a child psychiatrist. He's board certified in psychiatry and neurology, general psychiatry, and also child and adolescent psychiatry. He's also has another board in preventive medicine. He currently lives in Missouri, and he's a practicing physician there, Dr. Faheem Arain. So, Faheem, welcome to our podcast today.
Assalamu alaikum.
Hello, how are you? So, let's start off by a little intro video, Dr. Faheem, and then we're going to get back to you about some of the facts and some of the issues that are going on. All right. Just I want to let you know that we also have a live audience here. There are a lot of questions that come in, and we try to address them as we go along. So just be aware of that. All right.
Right.
All right, Jeremy, let's have a look.
Most of us only ever share the good things. We don't like to share how we really feel. Every morning when I wake up, negative thoughts stream through my head. Getting out of bed and pretending I'm okay takes all the energy I have. As the day goes on, the negative thoughts turn from a stream into a river. The water rushes through my head so loudly it's hard to concentrate in lessons. And some days it's so bad it feels like a waterfall that's trying to pull me over the edge. Everything is so overwhelming. I didn't think my friends would understand if I told them how down I was feeling. But when Sasha opened up to me about how stressed she was feeling, I told her. I wasn't sure how to bring up how I'd been feeling, so I started by saying that I didn't feel like myself. Just her listening made me feel like she understood. She told me some things that had helped her, so I tried them too, but it didn't make much of a difference. Even when I tried to be around my friends, I felt alone. The things I used to enjoy weren't fun anymore.
I was really worried about Andre and not sure what to do. He was quiet and wasn't hanging out with us like he used to. So I asked our head of year for some advice. He suggested I get Andre to speak to him since his negative feelings weren't going away.
I didn't want to speak to our head of year, but I also didn't want to keep feeling so down, so I went. He said that sometimes we have overwhelming feelings that can be more intense than our everyday feelings. These feelings hang around for a long time and change the way we feel, think, and behave. They can stop us doing what we want to in life. That's what I was going through. He also said that if we're physically unwell, we let people know, we ask for help. It should be no different with mental health. Sometimes our overwhelming feelings are brought on because of things in our life. Sometimes they happen for no reason at all. After hearing this, I felt much less alone and it felt good to talk. Scientists have found exercise can help when you're feeling low, so our head of year encouraged me to sign up to the school football club, which Sasha was already in. I still have days when the river is there, but now I'm beginning to understand my mental health. I'm learning how to cope. Our head of year reminded me that my friends, family, teachers, and lots of others at school are there to help just as much as he is. I had no idea the people around me could be so understanding. And while it's not always easy to talk about my mental health, the person I'm talking to might be able to help. If you don't feel like talking, that's fine. You could try writing, sports, reading, art, music, playing with your pet, whatever makes you feel better.
If you're the person someone talks to when they're struggling, just listen with no pressure or judgments. You don't have to have the answer. If you feel unsure about anything, you can speak to a trusted adult. Talking about mental health doesn't have to be difficult. After all, it's something we all have.
So, Dr. Faheem, we wanted to just
Yes.
start off with this topic. It's in reality a very, very sensitive topic, and I've seen that parents are a lot of times reluctant in talking about it, and kids, you can imagine, are absolutely devastated or don't even want to discuss this. I know it's a very vast topic, so just for our viewers, we're going to just try to break it down to three important components. One is going to be about anxiety and depression in kids. The second aspect will be about video gaming and what impact is that having on our teens and our children, and then other specific illnesses. So we'll just break it down. But we'll start off with this issue of this issue is not being addressed a lot, and that is in anxiety and depression. And I want to just throw out some statistics for you so we can have a look at and then discuss. There was a study recently done in by one in California, Los Angeles, where they looked at the major stresses for children, and they sort of highlighted the top 5 in each. In 1950s, the order was: number 1, home was the major stressor. School was the second biggest stressor. And then in order was church, peers, and media. In 1980s, home was still the number 1 stressor. And then school was still the second stressor. And then Pear's TV media church went down a little, but the others came up a little, and that is the TV and the media. And then now peer pressure is the number one stressor. TV media, whatever we get, and social media, that's included, is the second most, and then it's school, and then the home comes down. So a vastly changing trend. So that's what we are encompassing right now. We are seeing that there are a lot of stresses. Some are positive, but mostly the ones that we are worried about are the negative stresses. And amongst them, our interaction and the children having peer pressure and stuff is very important. We see that 2/3 of our children are at school worried about something, worried or anxious about stuff. So that's about 66. Every 1 out of 3 are okay, but 2 out of 3 have a problem. 4 out of 10, Dr. Faheem are unhappy due to whatever reasons. They are unhappy. They don't feel that they are understanding what's going on. Life is an issue for them. And
Yes.
then 1 out of 4, that is 25% of them, feel hopelessness. What's worrying is statistically 1 out of 4 children contemplate about suicide. So 1 out of 4 will be worried about doing suicide. And it's right now in the US, at least, the 3rd most cause of death after accidents and homicide. The 3rd most, and in fact, in some of the states, the homicide rate is low, and accidents and suicide, or cause of death, suicide by teens, is the 2nd most cause of death. I said, and then the other staggering figure, which is very worrisome, is that 10% of the children will attempt suicide. And then I got this off from one of the psychiatrists sending this, and I'm going to read this quick little poem. It says, this is by an actual girl writing something about something that the parent, actually the teacher, found. And she goes on and to say, once upon a time, there was a girl who lived on lies. She wanted to hurt, she wanted to die. She even attempted suicide. But the plastic people who said they cared didn't give a damn about what she dared. They didn't know, and she wouldn't share. She can't tell anyone what she fears. She can't live anymore and get near. The parents say every day, ignore it, dear. It will go away. But also, it doesn't. It gets worse every day. And more she hates feeling this way. Her face a cold mask, waiting for someone to ask. But no one dare, because no one knows about this nice girl whose month stays clear. There is nothing for her to do until she at last sleeps forever, free of the past. So that's what we are seeing astonishingly nowadays, Doctor.
Yes.
Tell us what's happening with our kids, and how do we first of all even start identifying this?
Bismillah ar-Rahman ar-Rahim. Thank you very much, Dr. Khan, for inviting me. I hope you can hear me all right?
Very clear. Very good.
Okay, yeah. Your data that you presented is up to mark. I don't know what the source of the data was with the stressors, but yeah, it is quite close to what we see in the clinical realm as well. Peer pressure media has superseded all of the stressors that we ever have experienced in the past. And that's what we see clinically as well. I want to begin by just giving a little bit more introduction about myself and how we interact with those patients and those
Please.
children. I'm a
Please.
child and psychiatrist. I work in an inpatient setting, a 54-bed hospital for pre-adolescents, and so we have a unit for ages 3 to 12, and then we have patients from 13 to 17, and we have 4 units each for those. And this is what we do all the time. This is what it is, and it's acute
Sure.
care hospital, and we are actually running full.
Sure.
So yes, coming back to depression and anxiety in children, adolescents, and teenagers, this has been the suicide rate is alarming. It's been going up higher. The rates for depression and anxiety also higher. There has been children we have seen are living in tremendous amount of stress. There is stress of academic performance. There is stress of comparison. There is stress of peer pressure, just related to peers, sports, different activities, and sometimes things get a little overwhelming for them. And it's important that the teachers, the school counselors work with the children, try to identify who the children are. And counselors are very common in schools, as you know of. But it's extremely important for the parents and the counselors to partner together and try to identify if there's any child that's getting overwhelmed or getting a little carried away with all the academic pressures or other pressure that he or she has been handling, and trying to process that. And if they don't, at some point, if they're not able to do so, then that's when mental health, advanced mental health like psychology and psychiatry gets in. That's where an assessment is made. That's when we make a diagnosis. And usually childhood depression, which has a prevalence of close to 3 to 5%. It's not, thankfully, not very, very common. Not as common as ADHD, which is 13 to 14%, 15%. Anxiety is more common, but untreated anxiety leads to depressive symptoms. And if left untreated, can unfortunately culminate into self-harming thought, suicidal thought, which if left untreated can be. And gone are the days when we used to say that they were protective factor. You mentioned family protective factor. Family could be a stress as well, but the protective factor, environment, religion, connection with the mosque or the church makes a difference. A teamwork or a camaraderie, a child support system helps the
Sure.
child to move forward.
Sure.
But
So let me ask a question,
so
Faheem.
left-
So I'm gonna break it. Sorry, interrupt you there. Just to break this down. So first of all, we want to try to know. Yes, you're absolutely right. What is the? I'll just try to break it. What's the difference for our viewers about when they are depressed and when they are anxious? How would you know? The data that was on the suicide was on 9 to 12-year-olds that they feel depressed, and then the attempted. Obviously, the group that you're mentioning is a little younger, and it then depends when they go in their teens is a little bit different. So if we have,
Right.
let's say we have a teen, what are the first signs you would see that it would alert someone that this person is is probably depressed? Of the important stressors, and I would go through probably some of them. They've highlighted family, especially marriage, is one of the biggest stresses in the kid's life. And we're in a day of an age where 50% of marriages end up in divorce, and second
Right.
marriages 66% or 60%. And then in the family there is addiction, which is
Right.
alcohol, drugs, you name it right now, different. And then of this, there is obviously sexual molestation, and in girls is very high, 1/3 as reported by age 18. And then after that, after the family, is the media and the school. The social
Right.
media, the interactions they're having is one of the stressors. Very big. These are all negative stresses. And then the school stressor, which
Right.
is also very big. Especially nowadays, the media, the stresses that when they're in 50s, when they were watching, they were telling everyone, oh, you drink, oh, you live, oh, you gamble, oh, you smoke. And now violence and sex, gender identity, all of these are issues. So let's say they're
Right.
facing all of these stresses. These are all negative stresses growing up, and someone is exposed, but you don't know. So you don't know. But how would you, what signs would we look for to say to our viewers, to say, this girl or guy may be depressed?
Right.
So just
there
a
would
few
be
identifiers on the stresses for us, that we know the stresses, but what are the things that you look for as a doctor and a specialist, say, you got to seek help. Then we'll come to when to come and definite seek help. But parents can start some sort of methodology beforehand, right? Getting alert to that their child is having some episodes or maybe depressed or maybe having issues. So please.
Thank you very much for pointing out. Yes, so we look for important clinical signs, and we ask family as to what is it that they have noticed. Is there a change in the child? Is there a pattern change? They are not same. They're sleeping more. They're isolating more, sleeping less, not interacting with peers. They're spending a lot of time in solitude. They're not interacting with the family members as much. They're stealing gaze, not making an eye contact, just being in a sad mood or irritability. In children, what we have seen that more than sadness is irritability. Just
good.
being irritable all the time.
Excellent.
Upset at the world, at everybody, and parents sometimes see that as disrespect. Like, how dare you talk to me like that? I'm your father.
I do
or I'm
that
your
all
mother.
the time,
Yeah.
Fahim. I do that all the time.
Right.
I never think, they may be anxious or depressed or there's some issues going on. So that's a brilliant,
Right.
brilliant point. When they are irritable,
Yeah.
don't, we
When
do that all
they're
the time to say, hey, get lost, or what's going on with you, and you don't appreciate what, that comes out of every parent's mouth. You don't appreciate what you have. You got a lot. You're not. So very good point. They're irritable. So what should we do? You find someone, he's irritable. I actually know a few of people, even just recently, some teens getting involved in this sort of things, and their father and mother are worried. They want me to intervene and say, try to do something. What would you suggest? Okay, they're very irritable. That's one of the signs. They may be withdrawing. They may be lashing out. They may be acting out. They may not be in a typical depression mood, withdrawing, going in a room, sitting aside, not eating, drinking, not speaking to their friends, not doing all of that sort of stuff, but they're irritable. Okay,
Right.
go on. Tell us if there's any other signs we else should look for.
Absolutely. Irritability would be I mentioned, and it's not like waking up on the wrong side of the bed irritable. It's just irritable most of the time, and that continues for over 2 to 3 weeks at least. And it's more become a pattern. The change in overall temperament or personality of the child has happened. So that's something that we look for. And then we also look for academic deprivation. If there is a little bit of a decline in academic skills. So the
Excellent.
grades are a great
Excellent.
reflector of the child. So
Oh,
when
brilliant,
we
brilliant.
are making that's one thing we always keep an eye on, is how are your grades at school? Everything okay at school to begin with? And they would say, yeah, grades are suffering a little bit. And you would ask, why is that the case? Oh, things are becoming overwhelmed. I've just transitioned to 9th grade or 10th grade
Oh,
to
brilliant.
high school.
So their
Started
grades
catching
may,
up with-
Fahim, their grades may go a
Maybe.
little bit down, and we're thinking they're not studying. They may not be studying because they're showing other signs of depression, or it's not that they are not capable, but we start thinking they are not capable. To get them, my reaction would be, you got to do extra class. You got to do more tutoring. We're going to say, oh no, you need more tutoring. You probably need extra work at school. At the end of the school, you're going to sit back and finish this work. But you're saying their performance is going down. It's a subtle change, and that may be a clue that there is underlying issues going on. And that's brilliant.
Underlying.
Can I say
underlying-
this, Fahim? I just want to add this other little point. You bring this up fantastically. Mental health is so big in even adults. And we don't even think about it. We don't even try to address it. And in kids, it's really, really sad. I mean, it's how we're as grown-ups been acting towards. It's really sad. So really appreciate. But please go on.
Yeah.
Tell us a little bit more. Is there any other sign we need to look for, or do you think these are the two most important signs?
Well, there are several other signs. And you see, obviously, their relationship starts suffering, they start losing friends, because irritability just not at home, but it also continues in school. They're being reprimanded by teachers, disrespect teachers. You start hearing conduct problems, for example, in-school suspension, out of school, and they start getting more and more discipline at school. And school are pretty good in recognizing those signs. The counselors are involved. They're involved here. Sometimes they pick those up, but sometimes they slip through the cracks and they miss it. And so it's important for parents to recognize that that's an important.
I have a
They
quick
would
little
not be
question.
interested.
I have a quick
Yes.
little follow-up question, which has come up very nicely in the conversation that we're having on the side here. I don't know if you've got access to it. Someone has said that, how do you know a kid may be being molested? Whether it's physical, mental, there's some molestation going on. And especially in conservative cultures, where you have your religious gurus
Right.
across the board, and there may be some there. People are very tight-lipped about it. And then the second area is something going on at home. An aunt, an uncle, another family member may be doing it. It's a very tough thing. How would you identify that, Dr. Faheem? And is there a way to identify? And how do we keep an eye? And how do we get it out of the kids saying, oh, this is actually going on? Please explain. What do you see in clinical practice? And how are you
Yes.
able to sort of combat that? So that's a
Trauma
very brilliant
is-
point someone brought up in the chat. Mhm.
Yeah, that's an excellent question. And as a matter of fact, that could lead to anxiety and depression. So, highly commendable. But
So Dr. Faheem, I'm sorry, your voice is breaking up a little bit. Oh, my iPad is gone off as well. That's a sort of like a brilliant question. We'll try to get Dr. Faheem back on, see if he's.
Hello?
Yeah, your voice has just started to become a little bit distant.
Can you hear me? Can you hear me okay now?
Give us. Yeah, we can hear you now, Dr. Faheem. Please.
Okay. So that was a brilliant question, by the way. And so it really depends on the age of the children. So if you're dealing with younger children, they will not tell you that something has happened to them. They would reenact whatever had happened to them. For example, if they have been physically or emotionally abused, they will start reenacting the violence. So they would become more violent because that's what they have seen. Sexual abuse, and I don't know what the age range of your audience is, so and how much can I go into depth discussing this, but what would happen with children?
We mostly have
is
parents. we
parents,
mostly,
very
yeah, parents, and
wonderful.
some of them are brothers and sisters. You could say they're mature audience here.
wonderful. Alhamdulillah. Okay, so in children, younger children, they would reenact whatever had happened to them. So we would see some kind of sexualized behavior, some things that they had that you cannot even imagine. Like, for example, we have seen humping, we have seen excessive masturbation, we have seen some kind of other sexualized behaviors like them taking off their clothes or doing strange things, which is something that's completely out of ordinary that they haven't done before. Like mom and dad are giving a shower or a bath to a child and the child would act up in a very, very strange way. There are so many examples, but it's something that we.
So there's a counter question I'm going to ask you from this. You're saying when they start to act a little bit out of their norm, you got to be
Right.
smart in identifying that. Here's a counter
That's right.
question that someone's asked. How should we start to educate our kids? First of all, yes, we understand we should educate them about media, about the stressors. That's a definite dialogue. But someone has said, well, what about sex? How early did we tell them, and how early should we start educating them? Because I remember my child, I have a boy, and they were in school, and one day they came to me and they were saying, Dad, Coke is bad. Coke is bad. And I said, yeah, man, Coca-Cola is not good for you. It causes your stomach. And I said, and he's only 7-ish. And I said, yeah, Coke is bad. And then he said, no, Dad, it can do bad stuff to you. And then sort of I looked towards him and he's talking about something else. Not the black Coke. This is a white Coke. And if you see it in your house, you should tell someone at school. And I was like, okay, this is Coke. This is not Coca-Cola. This is the proper Coke stuff. And I was like, man, I was asking, should that be talking about this? He's only freaking 7. I mean, he's very young. Coke. And actually now, so we're across the board, a conservative societies, 7-year-old, 8-year-old. Well, should we be talking about Coke or sex or issues like this to them? When is an age? What would you suggest as a doctor and physician? And what do you think is the right time to start putting some of the thoughts to them? And I can tell you again, across the board, and this is for conservative societies abroad especially, their parents do not have discussions about sex. Zero. It's zero.
Yes.
And discussions about your uncle or your aunt is the most biggest prestigious thing in your life. How dare you even look at her? Tell us what should we do, and what's an advice you should be giving?
Right. So there's one important thing I wanted to finish of what I was telling earlier about, sexualizing behaviors. Some of those behaviors, what really becomes challenging, Bhai, is that some of those behaviors in younger children could be normal too. For example, masturbation in younger age boys and girls is common. It does happen. What really becomes uncommon is something which is out of proportion. That if someone is doing this more often. So that's beside the point. Moving on. Yes. So what is the best age to talk about these things? Well, at age 7, I wouldn't recommend talking about sex openly. I wouldn't imagine talking about drugs openly. What I would tell them is, touching, good touching, bad touch. Very, very simple things. What is the difference between good touch and a bad touch?
Oh,
well,
brilliant.
There is even an easier way to describe that. Bathing suit sites. So only mom and dad can touch your bathing suit sites only with your permission. Nobody else is allowed to touch those sites. That is an important take-home message for the children. Now,
that's a really
teaches them. School teaches them, and I think mom and dad should also be teaching them to their children. Then, when they enter into puberty, that's when you start opening about, different things about sex. Well, here in schools, they talk about safe sex. We, as a clinician, I educate abstinence. I tell them, wait until you're married, and then, and God forbid if there is a slip up or anything else, there are a few things that you should be mindful about. What are some of the consequences that can go wrong? And few of the consequences like sexually transmitted diseases. And I actually name them. I tell them what they are. HIV is one of them. Hepatitis B and C is one of them. Herpes is one of them. Chlamydia, gonorrhea, and what are the consequences for someone having them? What would happen to people who would have those sexually transmitted? I would educate them what pregnancy means. What is teenage pregnancy? What are the prevalence of teenage pregnancy?
Okay, so you would bring that. So you would start bringing those. You got a spectrum there. You're talking about. You're as saying you're practicing safe sex. That's number one. You're telling them
yes.
Have some abstinence. which is,
Yeah.
and we have some in our, we discussed that abstinence being or versus married sex or having sex later on when you mature or etc. But if you see a trend, then you're going to tell them, hey, these are the safe parameters you have to bring up. You probably discuss still HIV and other issues with them. Is that right, Faheem?
Absolutely.
And then
Absolutely.
and then you're saying, depending upon where their background is and what they're involved in, it's really a case-to-case sort of thing with that sort of thing. Is that right?
Absolutely.
But
yeah, it's not a head that fits every head. Every child is different. Every approach is different. And your clinical, Amir Bhai, the clinical interview is a litmus paper test. 35 to 40, sometimes up to an hour, depending on the child, is all that you need to try to get to the bottom of what you're trying to get at. And that's why it's so important that if parents are concerned about certain behaviors of the children, is to get an assessment done. And they're not to feel taboo about it, not to feel stigmatized about
it's
this.
a big issue. It's such a big issue. No one wants to get assessed for mental health. If I say I have a mental health issue, people still would start looking at me like, oh my God, he's mental. I knew it. They're going to say, he's already mental. He's already, because you don't know what they're going to start. It becomes up a lot of little issues and there's a lot of, so how do we get over that? How do we get over that? If first of all, and you bring up a very good point, which I actually did want to discuss later on in the second part of the show, where about a little bit about behavior therapies, a little bit about seeking early help. So we'll probably get to that question. We'll just pose it there, but we'll get back to it later on if you're okay with that. So we were on the topic of, hey, if they're having anxieties, they're having depression. And now, so what if I have a counter question which has come up earlier. A kid comes up to you and say, Dad, I'm depressed. You can't help me and I'm depressed. What should a parent do? What is it that we can tell them? I know you're going to say, oh, come on, let me take you to a doctor. And he says, no way on planet Earth I'm going to a doctor right now. I'm not going to any psychiatrist. I'm not, and I don't want you to say anything. Otherwise I'm gonna.
Right. And believe it or not, we do see that as well clinically. And yes, it happens. It's not easy for anyone to open up. So it's easy to say that I've got diabetes, I'm treating for it. I've got hypertension, but it's not easy to say that I've got depression or I'm taking a medication for that. Unfortunately, that even though that has gotten better and people like you who are educating others, and inshallah, if you get a chance, we'll do more and more of these sessions to educate people about this. But education, that's number one. Number two, education for destigmatization, what I was trying to say. To destigmatize this whole thing, the taboo of mental health needs to go away. By the way, American society was like that 40 years ago, and look where we are. The times have changed. Psychiatry residency, for example, as you know of, is most sought after residency, and very few spots are left unfilled, as you know. So, supply and demand, and people are educating, and they're getting there. So if a father is, coming back to your question, and sorry for digression, if a father is asked by a child, that I'm depressed, then a father should be friends, should connect, try to connect with the child, spend more time with the child, and ask him as to what does he mean by feeling depressed. Because depending on the age of the child, sometimes they don't know what depression is. So are they talking about depression as a symptom, or are they talking about depression as a syndrome? Because those are two different things.
Good point.
I'm having a bad day, so I'm feeling depressed. Or I saw whatever is going on in Middle East makes me sad, makes me depressed.
Oh my God! I'm glad you mentioned that. That's come up so much right now, Doctor, because they're watching this social media, they're watching these deaths, And just in the last week, I can tell you 2 people coming up to me saying the same exact thing. And my reaction to them was, turn off that social media. And one of them would say, I'm not turning it off. I can't do it. It's like if I do that, then I'm a traitor. I'm a traitor to my country, or a traitor to my religion, or a traitor. I can't turn it off. I'm getting depressed. I'm losing focus. And I don't know what to do. This just came up like in the last week or so. This is someone saying, and especially we're seeing war times issues. Some of us are involved more, and a lot of our people are not involved. And the pictures that are coming out from there, deaths of kids after one and another and another and
Right.
anyone. So what would you tell them? What would you tell, first of all, those parents? And then the second part would be just them talking about depression as a day thing. No, depression as an ingrained thing. So
Right.
you gave a brilliant advice. Okay, spend more time. Try
Spend
to
more
become
time.
friends. Try to become
Try to
friends.
get to know them a little better. Try to find out as to what exactly what they're trying to say when they feel depressed. To have a little bit more meaning. To have a little bit of feedback, collateral information from the teachers, from the school counselors. A lot of times they're brought to attention by others, but it's very good if as a parent you are at the forefront and you are the one identifying those symptoms. That's wonderful. So you would see it. You know, your child is not at the dining table anymore. He's avoiding you. He doesn't want to be a part of the family anymore. He's more spending time in solitude in his room. He's isolating himself. He's spending a lot of time on gadgets or social media. Just FYI, Amir Bhai, I'm not sure if you heard of it, state of Florida has banned social media for anyone under the age of 14. Did you hear that?
How it's not going to work. I don't know. I hope it works, but how could you ban social media?
So if someone is under the age of 14 cannot even access, now it's a longer debate, and I know that people who are pro social media, against social media, but my issue clinically, what I see at the hospital is I see that unfortunately social media can be, yes, it's very educational. It helps people to learn a lot of things. There's no doubt about that. But then it comes with a lot of negativity as well. And if an adolescent or teenager doesn't have the capacity to filter what's right from wrong, you're basically feeding all that negative information. Like you just pointed out, all those gory pictures of children dying and people dying. Yes, it does have an impact. I mean, yes, you want your children to know that there is a war, there is a famine, there's people who are suffering. But seeing those images over and over again can have a traumatizing effect on someone. It can be depressing. I'm not saying to take it away, but to educate them in a different way and just trying to not to restrict it, but to minimize. So there should be a time set up. So the American Academy of Pediatric, for example, evidence-based feedback is not more than 1 hour out of 24 hours for screening. And that includes social media, TV, and everything else. Now, it's hard to follow, I know that, because you would argue that most of the education is on computers nowadays. Everybody has a laptop or they have Chromebooks, and students are studying on Chromebooks. Well, we're not talking about education material. We're talking about leisure. We're talking about fun stuff. So it shouldn't be more than 1 hour. And that too should be okayed. Now, so there are certain apps that you can download on your children's phones, and you can monitor as to what is being downloaded.
Only when they're, Faheem, only when they're 6, 7, 8 years old. I'll tell you this when we come back. We're gonna take a short little break, but I'll tell you what happened with my. We're gonna pick up the conversation right from here when you're talking about these app and gaming, because there is a few questions on gaming. Yours, because how much time is appropriate? When should they be seeing it? What about stuff? We're gonna take just a 2-minute break. We're gonna play a video and we're gonna come back regarding this and conversation, because that's gonna be our next part. Gaming video, and we're running out of time already, but gaming video, and just talk a little bit about ADHD and just give us an overview about common diseases.
Most of us only ever share the good things. We don't like to share how we really feel. Every morning when I wake up, negative thoughts stream through my head. Getting out of bed and pretending I'm okay takes all the energy I have. As the day goes on, the negative thoughts turn from a stream into a river. The water rushes through my head so loudly it's hard to concentrate in lessons. And some days it's so bad it feels like a waterfall that's trying to pull me over the edge. Everything is so overwhelming. I didn't think my friends would understand if I told them how down I was feeling. But when Sasha opened up to me about how stressed she was feeling, I told her. I wasn't sure how to bring up how I'd been feeling, so I started by saying that I didn't feel like myself. Just her listening made me feel like she understood. She told me some things that had helped her.
And this is about we're going to come back for the second part, and we're going to discuss about a little bit about gaming and videos and stuff like that.
Yeah.
Okay, your just camera froze for a second. So you were just saying about put apps on, and I'll tell you this, that when I put an app on, the kids' mission in life at night would be, how do we hack the website and get through dad's mobile and stuff. So what they would do when I'm asleep, they would sneak up to my phone. They would get that from my bed. They would try to hack into my phone. They would try to hack into the internet. They created a diverted internet system. So me being happy, I've done it, and actually it was going to another one, and they were using another one. They became so smart they hacked it every single time, and they were just not ready at that to accept that I can forcefully say you're not working on the internet at specific times. And even me tracking their hours and stuff was not happening. So a lot of resilience. They became smarter and smarter. So you're saying, and we want to talk about a little bit about this issue of gaming. How much time is enough? When do we tell the kids there's a certain time you could control them, and then after that you have to infuse in responsibility in them. You can't control them, Maya, after that. You have to tell them you're grown up, and unfortunately that age is very, very young right now, and then they're very resilient. I know a friend of mine who is in his 40s and he's addicted to playing games. He's 40s every single time, and he go home any opportunity he wants to play video games. So doctor, tell us, what should we do with our kids? How do we address that issue of gaming addiction? When do we know it's becoming an addiction? And then what should we do about it?
Very good. We need to be recognized, for example, and this is a very good podium to have that discussion. Internet gaming disorder, by the way, has now been officially included as a behavioral addiction for the first time ever in the history of medicine.
Really?
It's now in DSM-5. Yes. Okay. And there was addiction to pornography, sex addiction, those kind of things that people get treated for nowadays. But IGT, or internet gaming, it has become an issue and has been linked as a diagnosis for which people seek treatment. As a matter of fact, it's almost an epidemic in China, Amir bhai. People have opened rehabs for the treatment of internet gaming disorders, where people spent.
That's in China.
Yes.
I had I'll tell you a brilliant point that has just come across, and one of our colleagues is saying, well, I think we need to give training to the parents, because they're not up par with technology, and it's partially their fault. Gaming is actually okay. That's their counter argument, and I've seen a few of the kids saying that as well. You're too old. You're too old-fashioned. That's what I hear. You don't know about gaming.
Tell me about it. And this is something I hear. For example, it really depends on, first off, the access to the gaming system. So parents should have control of the games at all times. The controllers of, for example, PlayStation. the PlayStation controller should be in control of the parents, should always be given to the children when they have earned it, when everything is done, and it would be for 30 minutes to an hour increment with the same guideline of American Academy of Pediatrics, not more than an hour a day, should be given to them. They should be playing the games and then need to be monitored as to what games are they playing. There was a couple of studies. There was a negative study that showed there is no correlation of violence in the video games with violence. But then there was another study that showed no, there was a correlation of violent video games on the behavior of the child. As a matter of fact, some of the patients that clinically I work with, they tend to be more frustrated after 30 minutes, 45 minutes of the game that they have played, especially if they ended up losing that game. The frustration tolerance goes down. They're more irritable. They're more angry. They tend to lose control. There's more sibling rivalry, more sibling fights, a lot of those issues. It also depends on what kind of games they're playing.
Faheem,
Grand Theft Auto.
Faheem, some are asking, do you play games? They're saying you need to play games more. Or they say no, play games is playing. I think the point is, it's okay to play games. And I think where they're leaning is that it's okay to see violence in games because they're out there. But it's a matter of understanding. We have to tell them, can we tell them, it's okay to kill someone on the internet, but it's not in real life. It's get your frustration out. Some are saying, I get my frustration out very easily. I've had a rough day. I go and punch a few people. There's a boxing game I love. If I have a gun game, I can go play that. What would you say to that, Faheem? Where there is definitely an argument. I know you're trying to limit. I'm not sure.
Yeah.
How do we address that? Where the counter argument is, no, you need to actually play with them games. You need to go and understand with them the game. Then come back and give a counter argument.
Right, but cognitively, some of these games are not designed with that audience in mind. And that's what I'm trying to say. If you look at the rating of the game, most of them now come with a rating. Some of them are R-rated. Mm-hmm. How can we give it to a 14-year-old? That's my argument. And that's what I educate families. By the way, I have 3 boys. And I try to practice. I'm not saying I'm always a perfectionist, but I try to practice what I preach, and it is a challenge. I know the other day when you and I were having a conversation about smartphones and everything, that is one of the things I was telling you about. It is a challenge, giving my 15-year-old son a flip phone. By the way, he did a good job with that flip phone. He carries that flip phone. He doesn't want to share that with his friends that he has a flip phone, but he has a flip phone. And I told him that till grade 11th, we are doing a flip phone. A phone is a phone, and the necessary argument is that you should be able to communicate with people, not like you should be communicating with the entire world. You just need to be communicating with the parents for several reasons, or if you have an emergency of some sort. So, alhamdulillah, he took it well, but he wasn't happy yet. He wasn't happy because a lot of his friends, everybody, as a matter of fact, iPhone, except him. It was not a matter of affordability. It was a matter of principle, and he got it. So coming back to the point, getting to know the video games, I completely agree, but it should be given, instead of you at the end taking away the video game and make it look like a punishment. My argument to the parents are, you make them earn those video games. Make them earn to play those video games. And how's that? These are the games you're allowed to play, be it cricket, be it racing, be football, or Madden, or whatever, NFL, whatever stuff is out there. There are games which can be easily played without any violent stuff in there. Without
how about this, doctor?
GTA.
How about this?
Did you hear about?
I'm hearing both sides.
Sorry,
I'm interrupting. I heard both arguments from this side of people saying, I have kids. They're no way gonna accept 1 hour, 2 hour. On the weekends, they're gonna say, go to hell if you're gonna put us that. And I know this is true. And I know, so it's like every parent will tell you what their kids would go out and do, to the extent they will, you're lucky you have that kid, but a lot of them are not going to listen. But how about we say this, that there is some responsibility of the gaming people as well to try to put some inherited restriction on a game. So when they are letting audience to see, right, that game or let play, you make sure, like how Apple does, that the parents is giving access to them. Now that is one way, but which I think could work. But short of that, and looking at the reviews right now and people talking about it, it is very, very challenging just trying to restrict them. And it is very, very, gaming is and such. When do you know it's become an addiction and now you need to do something about it? And then what are the treatments for it? Tell us a little bit about both of those, because I know we're running out of time, Faheem.
Yeah. So definition of addiction is that a child or adolescent, teenager, or even adult is spending so much time on gaming that it's interrupting their lifestyle. It really is interrupting their lifestyle. They can't do anything else, 7, 8, 9, 10, even more hours. And whenever they are not playing the games, they are in a state of an emotional withdrawal. It's almost like a withdrawal that you see. And that's what I was referring to earlier. Some of these children with a low frustration tolerance tend to be more aggressive.
So what you're saying, when they are going away from the game, you have to see what their attitude is, right? Are they even able to function in the normal society again? And if they are not functioning, there is some withdrawal from it, just like how there is from alcohol abuse, from cocaine abuse patients, or sometimes we see there is going to be a withdrawal from gaming. What are those withdrawals that you see, doctor?
You see a change in their mood. You see a very straightforward change in their overall persona, their anxiety. They're more anxious. They're unkept. They don't take care of their hygiene. They're not sleeping at night. They tell you they're sleeping at night, but the parents are aware that sometimes, they are getting up and they are playing those games. A child feigns sleep, only sneak in some playtime in the dead of the night is a very, very common story. Social life, academic life, physical fitness, sleep, all of this starts getting affected. So you see, it's almost like, like a father who was approached by a child saying that I was depressed. That child could very well be having issues with gaming system. And it has become more of a pattern now. Someone who's preoccupied all the time, there is withdrawal, as I mentioned, there is tolerance. In other words, so if a child is playing 2 hours one day, he would not be satisfied with 3 hours the other day, will consequently increase the number of hours he's spending playing those games. So the amount of time, the tolerance goes up higher. So it's more like a dopamine surge in the reward centers of the brain goes up higher and higher. By the way, same logic goes for, and which I know is not the topic of discussion today, but same logic goes for pornography addiction. Same idea goes for food addiction. People who, just like are foodies and just like to eat all the time, and they can't stop. Binge eating disorder, for example, it's a very common thing. People are having a hard time getting rid of it. Now, it's not classified as a diagnosis yet, but the analogy is that you set your hedonic tone, which is the tone of the reward centers of the brain, so low that you basically, a little bit of dopamine, you're fine, versus patients who have internet gaming disorders or patients who are spending a lot of time playing and having withdrawal, their tone is set so high that only playing more time is going to be satisfactory. If you give them 30 minutes, they're not going to be okay with that because it doesn't set them up, and they will be withdrawn and sad most of the time.
So what are some of the steps you would take, or do you take in your clinical practice, Dr. Faheem, to prevent, to start going into some sort of therapy for the kids?
Yeah. I tell parents to be parents. I tell them that I don't want you to be a cop or a police officer or a law enforcement, but you are the father, and you should be able, father and mother, by the way, you work as a team, you can't work alone, and you tell them that video game is not a babysitting tool. playing system is not a babysitting tool. You don't hand them over and go out for dinner. That, oh guys, you play and just don't keep an eye on them. A, you need to be engaged. B, you need to make the children earn the gaming time. So, for example,
Yeah, very
they
good
have
point.
spent.
Very good point.
Yeah.
That
You
question
earn-
just came up by one of our colleagues, and he was saying it's exactly make them earn, set rules.
Make them earn.
Set your
make them
rules.
earn.
If you don't set rules from the
Absolutely.
beginning, you're gonna suffer. So if once you set
Absolutely.
rules in the house, that's a good, brilliant point you've raised up. Let them earn. Brilliant. Please
Let
continue.
them earn it.
I just want to
And
emphasize
lock it-
that point because it came up in a conversation. I thought it was a brilliant point before. Before. Okay. And any other third step or advice you?
Inshallah, when you visit our house, inshallah, in Kansas City, I'll show you. I mean, the controllers are not there. They are not with the system. They are gone. I provided to them once homework and everything else is done, all the chores are done, prayer has been prayed, everything is done. Then you earn it 30 minutes each, and this is the increment time that you. Now, does it always happen? Once again, not a perfect thing, but this is what I advise to the families. This is what I try to act on myself. It's not easy. I understand that. As a parent, there are a lot of challenges. But
So-
you set up a time. Your 30 minutes would be up in 10 minutes. So no matter what stage of game you're in, the time needs to be up in that particular amount of time. And by the time you educate them, you give them warning signs, and you tell them, okay, well, as soon as you get 30 minutes, that would be taken away, given to someone else.
Gotcha. So you try to control them. It's like a stimulus, and you control it, but you have to get
Absolutely.
involved with them. Here's another
You
question
have-
to. Here's another counter question. Just a last question on this gaming. Do you punish? Do you, in certain cultures, and I go back again, punishment, and especially sometimes punishment can be verbal. Punishment can be different form. But what about physical punishment? Do you recommend that at times? And is there any role to prevent, in general, we're talking about specifically kids, and I don't think we're going to be able to cover the mental illnesses other than that, but we do want to touch on quickly depression as we finish this show, Faheem. So first on
Yes.
physical punishment, is there any role? Is there any, what do you recommend? Is that bad?
Corporal punishment should not be there at all. You and I grew up in an environment where we had physical discipline, and you could argue that we grew up absolutely fine. As a matter of fact, better. We don't have PTSD, we're fine. But that's not the argument that we're having.
Good full
Time
stop.
has
Just put a
changed.
full stop to it. Physical punishment should
Abs-
not be done. It has
Should not
bad
be-
consequences, and
Absolutely.
I just want to emphasize that point in the whole podcast and this show as well. All right, it has bad consequences. Should not be done. Punishment, if you want to give to the kids, should be in other forms, taking away their games, taking away their play, their other pleasurable things that they do, but should not touch a kid. And I think that's a very good point that you've played out. There's so much. Just right at the end, Dr. Faheem, and I would love it that we can call you back because we do want to discuss a little bit about. There was a lot of question on ADHD. We have a kid
Yes.
with that. How do we address that? There was a
Yeah.
kid coming up talking about, I'm hearing voices in the middle of the night. What should I do? I'm very scared. And how do we address that? That came up. I'm gonna have to. And then there were other brilliant little issues that had come up as well, because they had a child who kept on moving his fingers in a specific sort of direction, and then the kids in sleep was another issue, question that had came up. What do we do about my kid does not want to sleep in the middle of the night, wakes up, he tries to do what he wants to do, and we are having terrible management issues. I'm going to leave those sort of, but just give us a quick little overview on depression management, because that was one of the things. When would you recommend behavioral therapy, CBT, and when do you think they should go on medication?
Yeah. So if the nature of the game is that if there is functional impairment, if the child is suffering, then prevention is better than cure. Instead of waiting and then treating it, identify the signs and symptoms. And if there is family history if the suicidal thoughts are persistent. For example, if the negativity is there, the grades are suffering, the anxiety getting to it, social anxiety is really, really onto the child, then go ahead and start treatment earlier is much.
So very good point. Can I just clarify that point? Two things. There are stresses in life, positive thoughts and negative thoughts.
Right.
Everyone is allowed to have some negative thoughts. All right, Jeremy? Everyone is allowed. It's okay to have a negative thought. And part of our evolution or us evolving as human beings is how do you tackle with a negative thought. All right?
Right.
You try to go towards positive thoughts as much as you can, but you gotta tackle the negative thoughts. And that's what's mental health all about. Controlling what Dr. Faheem is getting to. When those negative thoughts become so much that it starts impairing you from doing your normal functions of life, like you were sleeping well and you can't now. You were eating well and you can't now. You used to enjoy your friends' company, Maya, and you can't now. Then you know there is a problem. And that's when you know that you got to treat that. And whether that's with CBT, which we're going to have to discuss, I'm afraid, next go, what is CBT, or with some of the medications. That's the take-home message with this conversation. Faheem, thank you very much, my friend. Appreciate it a lot. I know we would sort of like a little time restraints, but this is such a vast topic to discuss, and we've just touched the tip of the iceberg, and we would love to have you back if you have some time on a Friday. There's a lot of questions still popping in about what, different sort of things, and I'm gonna have give the folks here your email. If they have any questions, they can sort of like be able to email you directly.
Absolutely.
So thank you very much, Faheem, as far as that you're concerned. Appreciated you coming on board with us and helping us out. For other staff and other people, I just want to say that there is a little assessment. Please complete that. And there is a question as well, and that is, what are the key stressors, positive and negative, in mental health for children, and how would you address them or fix them? And we do need to add about what are the key, these are positive thoughts and negative thoughts. Just remember that we have to start to think more towards positivity, having hope about things. And these are all positive things that psychiatrists and other therapists used to help to develop kids. We'll have another session about kids, and especially Dr. Faheem is in our county near us, the next state, Missouri, and he's such a wonderful person. I want to just reiterate one little charity cause that Dr. Faheem is also involved in. Faheem, do you want to just quickly talk about that and let our audience know about the project that you're doing with Misbah?
Yeah, so I'm actually the Kansas City rep for Pakistan Children Heart Foundation, and basically Pakistan Children Heart Foundation is people are aware of it, but if not, it's a non-for-profit organization in Pakistan that basically does charity surgery for children who have heart disease. A lot of these kids and families were going overseas; they couldn't afford. Issues with the visa. India is what the normal destination was, and they weren't able to get the visas.
Brilliant.
A lot of these kids were. So a lot of these procedures like ASD, VSD, neurology of fellow, transposition of great vessels, those are all some high-fi procedures that are only done overseas. But most of Pakistani families cannot afford that. So the hospital is almost getting in the final phases of completion in Lahore. Misbah Haq is our brand ambassador, and he's visiting on a regular basis. He was here in Kansas City a few months ago. And so,
Thank you.
One last thing, Amir Bhai, just one last thing about the positive and negative. Very, very well said. I would just like to add that our thoughts have an impact on our emotions. And that's why thinking positive is very important. I mean, even our religion talks about being positive, thinking positive, staying all above and staying positive, because positive thoughts have a positive impact on our well-being, on our mood overall, and in fact, our longevity. So
Brilliant
it
point.
goes.
We actually have, we want you to probably come back and address ADHD, but there is a separate discussion we want to have about why the children nowadays have become so conflict with religion. And there is a group that are, so that is the other topic we want to discuss with you, and gender identity in some certain kids as well. So diseases in specific, other diseases, but children and gender identity, children and religion misinformation, and how they get tangled in all of these little things. It's a very important discussion. We'd love it to have you back. There's so much to be discussed. But unfortunately, the time is sort of like the restraints right now we have. So we're going to have to do that hopefully next time, Faheem. Thank you very much.
Sure.
Once again, thank you, my friend, coming on and giving us this brilliant talk. I think everyone sort of enjoyed it so much. I just want to remind everyone, just once again, please write your a little paragraph assessment on AmericanMuslimToday.com/blog. You can put it there, or the second place is American Muslim Today, and there is a questionnaire on the Facebook as well. Please write your answer. We will be looking at all of the answers, and there is a prize for the one who does it best will get the reward at the end of the month. So appreciate all of you. Please do write that, and then I'm going to send some of them back to Dr. Faheem as well, that what the audience has understood. We look forward to your responses. Faheem, have a good one. Thank you very much, my friend, and thank you all of you. Stay safe, and hope you've learned a few little messages and got a few messages to take home. Thank you, guys.